No. Do I hear a doorbell?
Hi.
Great.
Hello, hey Sienna.
Hi, how are you doing?
Good, thanks, how are you?
How are you?
I'm all right, thank you.
Good. Okay, so how are things going with you? It's been a while since your procedure.
I guess okay, just anxious to find out like the status of things and what can be done. So.
Well, I mean, unfortunately, we don't have that great of news because we thought about every which direction in terms of doing your case, and you know, with you know, not much for me to see in the sense that there is no canal down below, but you know, the every which kind of direction we talked about, and Dr. Kwan and I have taken the time to kind of talk about every which direction to go with this. There's a real risk of you know, kind of making things worse, or you know, possibility could be that, you know, when we get in there, there's no ability to kind of mobilize that tissue to bring down in terms of your colon, because it's already been, you know, repurposed to do what it was, you know, when that second surgery where you had the pull through. So things are going to be pretty scarred down below. I mean, the tissues look fine inside, but you know, scar tissue is not something we can see on the outside. And the thing is, if we do all that dissection to kind of take out that segment, will that injure the blood supply to that segment, and then not allow us to bring it down to connect things on the outside. And you know, with dilation and things of that after the surgery, you know, we've seen some cases where people are fine during surgery, or you know, not able to, you know, some of the outcomes could be that we can't mobilize it enough to bring it down, so we can't do the surgery, or if we were already going to bring it down, it doesn't heal well and it actually detaches from the skin, and then you're not able to dilate, and then you heal with a segment of you know, like a segment that you can't really use, and then you're stuck with a segment of bowel that can even be worse, in the sense that, you know, if things close up, you can have mucus collect, you could get infections in the pelvis. So there's just a lot of risk in terms of you know, trying to do this dissection. And me, I know how much you want this, you know, and our main thing is that we want to make sure whatever we do is safe for you. And I know that you mentioned to Dr. Kwan, at least, that this is something that you want, that you'd even live with your current ileostomy. Is that right?
Yes, but I had to.
Yeah. So I don't know. I mean, there's a lot of things that, you know, the surgery is just one part of the thing. It's a whole part of the process. And then after the surgery, with all the dilation, kind of the moving parts afterwards, you know, I don't you know, even in cases where, you know, people haven't had surgery in the pelvis before, those complications can happen. And with you having had surgery done before on the colon itself, and also with that connection that they have with the pull through, to kind of detach that and then also mobilize that segment to bring down, means that all the scar tissue that's formed around it with its blood supply will have to be uprooted. And the risk is that when we do this for the second or third time, we'll not have enough to survive, because we have to bring all the way down to the perineum. And then, you know, if it doesn't heal well, that could be a possibility. I mean, the surgery may be done, but then if you don't heal well, then you still will not have a canal. That could be a very big possibility with, you know, kind of the tissues below. And, you know, I'll be honest, I've not been in this situation. I don't think Dr. Kwan has been in a situation where someone's had a, you know, anal pull through and then using that segment to make a vaginoplasty. How do you, Dr. Kwan?
You know, what I'm going to say is, I mean, you know, I do surgery for rectal cancer where you have to remove part of the rectum and then you do a connection, and the connection that you have is just like one of those connections. And when we do that, if something happens to the patient, you can't put more colon down into that area. So what I'm trying to say is the piece of colon that you could have had for this intestinal vaginoplasty it's already been used. It's already been used. And I also, when I did the scope, it's pretty scarred because I actually couldn't get the scope all the way through. which usually, because there's so many kinks, and that usually means that there's a lot of scar tissue in the environment. So I actually don't think it's feasible to get a piece of colon to be used as a vagina. That's my opinion. And I don't know if even if you found someone to do it, I'm not sure if I would recommend it, because I think it could be, it could be dangerous.
I'm not worried about that. I don't care if I have to die in the operating room table or from an infection afterwards. I have to try this, or my mental health is just going to continue to decline severely. It's already really bad. I can't even talk about it to you.
Mm-hmm. No, I think we both know that. We both talked about, how difficult this conversation was going to be. And as a result, I think Dr. Eng and I have talked about your case a few times just to make sure, like, she and I are on the same page, and like kind of, having a vision of like, how would we do this exactly? And, I think it's not, the concept of saying I'm willing to die on the operating room table, I mean, that's not just about you, that's about the surgeon and the medical team. And we don't really like do cases like that. Do you know what I mean? We don't think through things that way. So I feel that I can't open you up and try this out, because I already sense that it's not going to be possible for the intestinal vaginoplasty surgery.
I can't accept that. What do I do now? I need serious help. Who do I go to at this point?
I mean, I don't know, how many other surgeons have you seen before us?
I don't even know. Probably around somewhere between like 6 and 10.
To do a revision?
Yeah.
Wow. Yeah.
I mean, that's a difficult question. I mean, it's, I don't feel like I know you well enough, but I feel like if you were a family member, the help I think you need is to figure out how you can, people confront, unworkable problems in their lives, right? Unworkable medical problems, like women who can't have children, who desperately want to have one. I mean, I think the best thing I would say to you as a physician is trying to find someone to help you through the fact that you want something that is extremely hard to get done because you've had so much surgery already.
I've been in therapy since this happened. I've been on medication since I've tried so many, nothing helps. I go to therapy 8 times a month.
Mm-hmm.
Nothing's help. I'm not getting better. I'm just getting worse. If I don't even get attempted to try to get this fixed, my mental health is just going to severely decline, and it's already really bad.
Who are the therapists that you're seeing?
It's not doctor. It's Ryan. His name is Ryan Meyer, and I've been seeing him for 9 months. But my therapist before that, I was seeing for almost 9 years, and I've been seeing this same psychiatrist for 7 years.
And what are their thoughts?
My psychiatrist just keeps asking me about the progress of things in the pursuit of trying to get this fixed, and my therapist just tries to keep me calm. I just keep obsessing over the same thing nonstop. I can't accept this. I can't deal with it. I'm so traumatized. I can't even be in public.
So what happens if this is done and you don't have a canal?
Well, I already don't.
And so then that's not any different.
I gotta at least try.
But we did try. We looked for you. And this is what we think. We already told you.
I'm not willing to live the rest of my life like this.
What if we can't do it in the operating room? You'd still live your life like this. Right?
No, I would just refuse to participate in society, refuse to participate in life, and just continue to drive my life into the ground. I need serious help.
Yeah, the people, something happened, and then they say she was looking for help. No one wanted to help her
Yeah.
for so many years,
I've
and then it's
tried
gonna
so
be too
hard.
late. Then people are gonna say, she was looking and she was getting this, and then she went to this one and this one and this one. No one wanted to help her. Then things happen, and and because no one wants to get the risk. Like John F. Kennedy said. It, it, we went to the moon not because it's easy, but because it's hard. If it's easy, the easy jobs, people take easy jobs because, just like lawyers, like attorneys, they take the easy cases because they know they're going to win. But the ones that are hard, this a challenge, they don't want to take the challenge, because it's their career. I understand, I understand your point of view.
It's not because we don't want to take a challenge. So it's not because of that. It's not, we're not comfortable doing the surgery because we don't think that it is successful. I don't do surgeries or procedures that I do not think there's going to be a good outcome.
I understand.
Okay. It's also my risk and my license as a surgeon.
Yeah.
Look, we helped you. We wanted to kind of push this along. This is why we did the diagnostic exam. We really, I could have told you the first day I met you, this is going to be difficult. And this is not something we could do, but we went ahead, we looked, we did our assessment, and this is our assessment. I mean, so part of it, you have to respect what our assessment is. I understand this is very traumatic for you. I don't, I can talk to your psychiatrist, but like Dr. Kwan said, you are focused on having that canal. If you've spoken to 6 or 7 surgeons and with varied skills, and all are not willing to kind of do the surgery with you, there's a reason for it. And it's not because we don't want to help you, or we sign an oath when we join medicine to help people and do no harm. Okay.
I understand, but not taking any action is going to be doing harm to my life.
We looked. We did our diagnostics.
And none of
We
these
did our
other.
diagnostic, and this is what your assessment is. So you have to respect our assessment.
Yeah, we
And
respect
what we
that.
can and cannot do.
But also, the other surgeons that she has seen, they haven't done any tests like you did last time. That you put her to sleep, and you are the first one that do that. But the other ones, they just kept postponing the thing, But they never check her, so it's not that they check her and they couldn't do it. It's just that they just didn't want to do it. That's it, It seems like it's like something complicated, They just want the easy jobs. I understand. I understand, But I don't know what to say, because.
You telling me that I can't be helped is just telling me that my life is over, and it's my birthday. This is my birthday. I got to think about this every year from now on, and it's going to be the worst day of my life having to remember this. That this day I was born, and
I did not say you cannot be helped.
Can you refer me to somebody that can help me then, please?
I can refer you. I mean, in terms of finding another surgeon, I don't know where you've been. Where do you live again?
I live in Nevada, Las Vegas.
Yeah, I don't know anybody in Las Vegas. I mean,
there isn't anybody in Las Vegas that's qualified to do this. I've already tried.
So, actually, I'd have to say I'm of the opinion that I would recommend that you do not seek having this done. That's my opinion. Because I think the colon is a dangerous organ. And so, for someone to say they can try and do this and, basically leave you with dead colon in there is dangerous. So I'm not sure it's appropriate to recommend you to have someone else do it. I think we've done cases together. Dr. Ng and I work as a team where what we're trying to say is not that we think it's too hard for us to do, but it's not appropriate to be done, unfortunately.
Yeah, I can't accept that. Like, you have no idea the impact this is going to have on my mental health. I need serious help. I've been begging for years. I'm willing to take any risk.
Well, I just personally feel like the perspective that you might, I don't feel like I'm going to be able to convince you of this, but I can't help but say that I think the help you need is to adjust to this limitation. You've seen so many surgeons, maybe they don't explain why they can't do it. I mean, there's a lot of information on you that we've reviewed, like reading your operative notes. There's a lot of information other than also hands-on feeling your anatomy, but the help I think you need is adjusting to the fact that with time, it's becoming quite unlikely that you're going to have a successful surgical reconstruction.
I can't accept
If,
that.
if,
I
if
can't
in 8
accept
years,
that.
if in 8 years you haven't got used to, I don't
I
think that
can't.
she's
I
gonna
just
get
keep
used
my
to it.
my mental
It's
health
not, it's
just
not something
keeps
that
declining.
that she have
Can
for
I
like
please
a
speak
year.
for myself? My mental health is fucking terrible. You have no
Mhm.
idea the extent of it. I need serious help or I'm never gonna get better.
I don't know that
I can't
surgery is gonna
accept
help
this.
you.
I don't mean to be disrespectful to you, but I just can't accept that answer. I'm gonna need you to refer me to somebody else.
I don't know that there's any referrals. There's other programs that you can contact.
Well, it depends on who my insurance approves me for. They sent me to you, and you guys are saying you don't want to do it. So I don't know where to go from there. You're going to have to let my insurance know that you can't do it so that I can continue on this journey. This is my life. It's important to me. I only get to live once. I've tried extremely hard to get to this point, and I cannot believe the lack of help that there is. Nobody even wants to try to save my life, because literally that's what you would be doing, saving my life. But you don't see it that way. I don't mean to be disrespectful. I really appreciate both of you giving me the chance to do the exam under anesthesia, but I'm not willing to give up on this. I can't accept this as my life.
Yeah, I mean, I can't block you from seeing another surgeon, but I also agree with Dr. Kwan that, I don't think it's a good idea for you to proceed. But, so I don't know who your insurance is contracted with. That I don't know. It will be in our documentation that we will not proceed forward. If your insurance can get that information, they can send you to another place for your insurance to kind of if you want to see another surgeon.
And can you send that to my primary care doctor as well so I can continue this pursuit with her? She cares about me.
Rosalind.
Dr.
Weingarten?
Rosalind Weingarten.
And that's where's she at?
Primary Care Center of Nevada, Las Vegas.
Okay. That's fine. I will also reach out to her too and see if I can have a chat with her.
Yeah, please, if you could make it as clear as possible what you have said with me, because I'm not going
Absolutely.
to give up. This is going to kill me one way or another.
I will reach out to your primary doctor and let her know about our discussion and what Dr. Kwan and I saw that day when we did your exam under anesthesia.
Okay, and how long should I expect to wait for you to contact her?
Well, give me at least a couple of weeks. And sometimes when I call her office, people don't call, usually pick up because I don't know what the clinic schedule is. So just there's a couple phone tag for a bit. But if I get her on the phone, I will speak to her next week.
Okay, well, I'll let her know that you're going to be trying to get a hold of her, and
Okay.
I'll keep
That sounds good.
I'll keep contacting the both of you until you make contact with her and get this issue talked about.
I will contact her. Don't worry. I'll make it a point to call her next week to have a conversation with her.
Yeah, I deserve
And
help.
then-
I deserve for somebody to try.
I agree. I want, in the sense that I hope you find some way to make peace with this. If it's not surgery,
I'm not going to
with your
make peace with
psychiatry.
it. It's destroying lots of lives already.
But I will give Dr. Weingarten a call. Okay?
Okay.
Okay, thank you.
Okay, thank you. All right, take care.